Caffeine is mainly consumed in coffee, tea leaves, and cocoa beans. Caffeine content can range from as much as 160 milligrams in some energy drinks to as little as 4 milligrams in a 1-ounce serving of chocolate syrup. Caffeine is also located in some over-the-counter pain relievers, cold medications, and diet pills. They can contain as little as 16 milligrams or as much as 200 milligrams of caffeine. Caffeine is actually a mild painkiller and often increases the effects of other pain relievers. People can go through caffeine withdrawal, which often means in most cases that caffeine is addictive. It is a stimulant to the central nervous system. Some of the symptoms of withdrawal include headache, fatigue, anxiety, irritability, depressed mood, and difficulty concentrating. These symptoms can go on for a few days. Caffeine does not necessarily cause insomnia, but if it is taken before it has time to get out of your system, it can inhibit sleep. Caffeine is mainly processed through the liver, so it has a relatively short half-life. It takes about 8 to 10 hours to get 75% of caffeine out of your body. It is recommended to stop consuming caffeine around 6 hours before bedtime. Moderate amounts of caffeine normally cause no harm in adults health-wise. Caffeine in high levels may increase calcium and magnesium loss in urine, so it could lead to osteoporosis. When someone is sensitive to caffeine, it could have a slight temporary rise in heart rate and blood pressure. It is suggested to discuss with your doctor if you already have high blood pressure and drink high levels of caffeine. There have been several studies that actually state that caffeine can help prevent against certain cancers. Caffeine can make a person want to urinate, so there can be a slight dehydrating effect. Although caffeine does act as a mild diuretic, studies show drinking caffeinated drinks doesn't actually cause dehydration, it just doesn't really hydrate the body either. Kids are more sensitive to caffeine than adults are. There is a caffeine crash that children can fall victim to easier than adults. The empty calories in soft drinks also put kids at a higher risk for obesity. Caffeine does not help you sober up. It can actually impair your reaction time worse when paired with alcohol. Caffeine can actually reduce the risk of Parkinson's disease, liver disease, colorectal cancer, and type 2 diabetes. In Japan, some medical students studied the effect of caffeine-influenced chemotherapy on metastatic osteosarcoma patients. They tested 41 patients and found out that caffeine actually did help in chemotherapy when the malignant tumors were located in the extremities or pelvis. It also prolonged patients' lives with pulmonary metastasis. The caffeine was administered as a serum to patients aged 7 to 66 years. In conclusion, the survival rate after 5 years was 28%. The article did not tell what the survival rate is for chemotherapy without caffeine. A study published in Springer Science used mice to evaluate the correlation between stress and caffeine intake. They used a control group getting just water and a group getting caffeine-enhanced water. The mice were placed in a plastic tube, rendering them immobile, and then they were decapitated and their brains were studied. It was found out that the caffeine-free mice handled the stress of the tube somewhat better than the caffeinated mice did. When women are pregnant, it is not suggested to drink high levels of caffeine. Caffeine is absorbed through the mucosa of the gastrointestinal tract. It crosses the placenta quickly and absorbs into the baby's central nervous system. Some people believe that it can have heavy side effects such as spontaneous abortion, intrauterine growth restriction, low birth weight, and preterm delivery. This study found that in an article published in the National Geographic, it has been shown that scientists are likening caffeine addiction to a heroin addiction. Roland Griffiths, a professor of behavioral biology and neuroscience at Johns Hopkins, is trying to get caffeine withdrawal placed into the Diagnostic and Statistical Manual of Mental Disorders. The DSM is used to help identify conditions and treatment strategies. Although withdrawal symptoms are not as bad as the symptoms of major drugs and alcohol, they are quite significant. Griffiths said that 13% of people had clinically significant distress or functional impairment with caffeine withdrawals. The onset of symptoms can start around 12 to 24 hours and continue for up to 9 days. In 2003, a caffeine study was conducted, and Time magazine reported that there are 167 million coffee drinkers in the U.S., and in 2003, they consumed nearly 6.3 billion gallons. Also in 2003, we consumed 2.4 billion gallons of tea and 15.3 billion gallons of soft drinks, 70% of which are caffeinated. That equals out to about 574 cans per year for every person.